We will now begin today's webinar. This webinar is being recorded so those unable to join us today can listen to the recording at a time that is convenient for them. A link to the recording and a copy of the presentation will be emailed to everyone who registered. I am Katie Ramos, and I am the Administrative Services Manager for Goodwin House at Home. It is my pleasure to introduce your program moderator, Beth Kilgore Robinson. Welcome, Beth.
Thank you, Katie, and good afternoon, everyone. Thank you for joining us today. We welcome you and know that we are truly honored that you've joined us. Over the past 18 months, we've experienced changes in our physical, cognitive, and emotional health. We physically distanced and socially isolated. We have worn masks and practiced good hand hygiene, and now we've been vaccinated. As we start the fall season, we want to continue to face, or we will continue to face challenges that will be caused by COVID-19. But we're also seeing the progress that has been made, as well as reports of decreased numbers in COVID. Today, we will hear from Dr. Margaret Gloria, who is the Medical Director of Goodwin House Palliative and Hospice Care, with more information to help us prepare for the coming months. Dr. Gloria has kept us updated over the months, and her positive, calm, virtual, and in-person bedside manner continues to help us stay encouraged. Before we begin our presentation and discussion, I would like to review a few housekeeping items with you. Throughout this presentation, you will see the PowerPoint slides and the presenter who is speaking on your computer screen. You may want to adjust your volume as if you're having difficulty hearing us. Also, everyone's microphone has been muted and your cameras have been turned off. Presentation. At the end of the webinar, we will have 15 to 20 minutes for questions, and you may submit your questions throughout the webinar by entering the question into the chat box, which is on the right side of your screen. Simply click on the question mark, look for the chat box, type your question in the box, send your question, and it will be received by my coworker, Katie Ramos. As we shift to the agenda slide, I would like to provide a brief overview of Goodwin House, and then we will hear from Dr. Gloria. During the Q&A session, we will answer as many questions as we can, and definitely those that were submitted in advance of this webinar. During the webinar, I encourage you to jot down any questions that you might want to pose, and we will definitely attempt to answer those as well. Goodwin House has a long history of serving older adults, and we work each day to stay true to the mission, which is to support, honor, and uplift the lives of older adults and the people who care for them. We own and operate 2 continuing care life plan communities, which are Goodwin House Alexandria and Goodwin House Bailey's Crossroads. We also serve as the managing operator for an affordable housing community for older adults in McLean, Virginia, which is the Lewinsville Retirement Community. Goodwin House is unique in that we support older adults wherever they live, including in their homes. In 2014, Goodwin House started Goodwin House at Home, which is a CCAH or Continuing Care at Home program. Goodwin House at Home is the only one of its kind in Northern Virginia, and there are only 35 other Continuing Care at Home programs in the United States. This program incorporates 5 flexible financial plans which pay for care immediately when care is needed or help is needed with just one activity of daily living. Our members are able to join or transition to one of our life plan communities or any other community of their choice. Additionally, Goodwin House provides older adults with a range of care services. These are available in our life plan communities, individuals' homes, and other senior living communities. These services include our Rehabilitation and Home Health program, which provides skilled nursing, physical and occupational therapy, and palliative and hospice care, which provides pain management as well as compassionate care at end of life. Our Stronger Memory program is a free curriculum-based program I love always seeing Miss Wendy there. Stronger Memory is a free curriculum-based program designed to help those facing mild cognitive changes with an early diagnosis of dementia or individuals looking to improve their focus and brain health. Our participants spend just 20 to 30 minutes a day, 4 to 6 days a week, reading aloud, doing simple math, problems very quickly, writing by hand. Participants have often commented that they see an increase in focus, memory, and recall. If you'd like to learn more about our Stronger Memory program or access our free workbook, you may visit our Goodwin House website or at strongermemory.com. Something new for Goodwin House is our Avonlea Community, which is a new planned community which will be located in Loudoun County between South Riding Market Square and Dulles Landing Shopping Center. Avonlea will be a mid-income level community, which will include an array of living and care options. Independent living, assisted living, memory support and home care, and home health therapy services will be available at this site. It will include peace of mind in knowing that you have choices and that you will be cared for along the way. Now, I'd like to go to Dr. Gloria. Dr. Gloria completed her fellowship training in hospice and palliative medicine, as well as internal medicine at George Washington University. She is board certified in internal medicine and hospice and palliative medicine by the American Board of Internal Medicine. Dr. Gloria proceeded a step beyond her ABIM certifications to earn the HMCD in order to also become a hospice medical director. Prior to joining Goodwin House Incorporated, Dr. Gloria served on the inpatient palliative care team at George Washington University. It is always a pleasure and an honor to work with Dr. Gloria, and I will turn it over to you.
Thank you so much, Bev. Hi, everyone, and welcome back. To get us started this morning, I wanted to talk a little bit about the phases of a pandemic and the timeline of a pandemic in general. All right, so this is a graphic from the CDC to start us out. If you notice, it says at the top that it's a framework for a novel influenza A virus pandemic. This page was last updated in 2016, so quite a while ago, but does anyone remember when the last H1N1 flu pandemic happened before this? Of course, we saw H1N1 in 2009, but it didn't get to pandemic levels at that point, thankfully. It was the flu of 1918. So the flu of 1918 was an H1N1 influenza A virus. It stretched actually into 1920 in 4 distinct waves. Sounds familiar, doesn't it? So this has obviously happened before, and in response to the possibility that another global pandemic might happen, the CDC put together this framework as a guide to pandemic response. I wanted to just review it a little bit. So the first 2 intervals, if you look at the graph, they make up the pre-pandemic intervals and involve investigation and recognition of a virus that has the potential to cause a pandemic. So that was happening for us in the COVID-19 pandemic in late 2020 in Wuhan, China, right? The 3rd interval is the initiation of the pandemic, and that happens when people are easily infected with a novel virus that has the ability to spread in a sustained manner from person to person. So for us here in the United States, we were seeing that phase of the current pandemic in February and March of 2020. Then the next phase is the acceleration phase of a pandemic, and that's when there is sustained and increasing person-to-person transmission. And this can come in waves, as it did in 1918. On the graph we're looking at is where you're starting to get to that very red color, and that was probably late of March 2020 when we here in the United States when we were seeing that. So on the other side of the curve, the deceleration portion of a pandemic happens when the number of cases reported each day, so the person-to-person transmission, steadily falls. So I'm here to argue this morning that we are indeed at the start of the deceleration phase of the pandemic, and we'll talk a little bit more about that in a moment. The very last interval of a pandemic involves monitoring and preparing for possible additional waves, and really that wave that work never ceases, right? So a pandemic generally ends, quote unquote, when the virus is considered endemic. So what's the difference, you ask? A pandemic is widespread, think worldwide transmission, accelerated transmission of a virus. When a virus is endemic, it's present in a population at a maintained and baseline level. So think the seasonal flu, right? Influenza is probably never going away. And remember that depending on the flu season, between 10 and 50,000 people die in the United States every year from the flu, but you never see the flu causing widespread shutdowns or disruptions or mandates because it's endemic, not pandemic, and that's the difference. It's something that we kind of live with and expect in our normal lives, and we do whatever we can to mitigate the risk. We get our flu vaccine every year. This is how it goes. Now, to be clear, COVID-19 is not the flu, they're very different, but we can use this framework. And using the framework, let's look at the next graph. So this should be familiar, but not. This is from the New York Times, and it's a graph that represents the number of cases that were reported, new cases of COVID-19 reported every day. We've looked at this for the United States. We've never looked at the worldwide data. So this is for the whole world, you know, the number of COVID-19 cases that were reported each day from the very start of the pandemic until now worldwide. So you notice the scale is a little bit different. At the highest parts of this curve, we're talking about 800,000 new cases of COVID-19 being diagnosed every day. It's the same as the graph that we've looked at before and we're about to look at in a moment from the US, in the sense that the dark red line on the top of the curve represents the 7-day average. So that makes it a little bit easier to interpret trends, okay? So the reason that I wanted to include this graph, we're going to come back to it, but the reason that I wanted to include this is because when we talk about a pandemic, going from pandemic to endemic, we're talking about what's happening in the whole world. Because as we've talked about, as we've realized with the Delta variant, what happens in the rest of the world affects us here, certainly, right? Usually we talk about the United States and the Virginia and Northern Virginia area specifically because that's what really applies to us. But today we're going to kind of think worldwide. So let's go to our next graph. And this is the same graph that we've looked at in the past, again from the New York Times. It represents the number of cases reported in the United States as a whole every single day. And we can see that we have our spring wave in 2020, we have our summer wave, we have our dreaded fall and winter wave of 2020. And then the number of cases really plummeted after that until that next peak, that's Delta. And Delta came about this summer. So the most important take-home point from this graph that I wanted to talk to you all about today is that despite the new variant, which is much, much more contagious than the original strain, our curve didn't get to the same peak. We had almost 250,000 cases of COVID-19 being reported every single day in the winter of 2020. And those were dark days, but we never got there despite Delta being so much more contagious, and it's because the vaccines are working. So that's really great news. And then you can see on the very right side of the graph, as we are in October, present day, that's October 2021, the cases are dropping steadily, and so that's also really great news. So speaking of vaccines, I did want to talk a little bit about vaccine boosters because that's the hot topic on everybody's minds right now. So Pfizer is the only vaccine right now that has FDA approval to be boosted. So keep that in mind. We're talking about Pfizer specifically. And so the CDC recommends right now that if it's been more than 6 months since your second dose of your Pfizer original series, and you meet certain criteria, which are listed on the slide, so you're over the age of 65, you live in a congregate setting like a long-term care facility, you're 18 or older and you have certain underlying medical conditions and immunocompromised is one of those. Or if you are somebody that has a high-risk job like being a healthcare worker, that makes you eligible for a Pfizer booster vaccine right now. They're pretty widely available, and I think a lot of people are in the process of getting their booster if they haven't already. So the Moderna vaccine, just so that everybody knows, they are planning to meet with the FDA on October 14th to present their data as to whether or not a booster is or is not needed. And then they're scheduled to have a CDC advisory committee meeting on October 20th to review the same. If you remember the process for the Pfizer vaccine, the FDA gives approval first, and then the CDC Advisory Committee meets, and they make a decision about whether or not they're going to recommend boosters for Moderna. For Johnson & Johnson, they're meeting with the FDA on October 15th, and then the CDC Advisory Committee is scheduled to meet October 21st. So the take-home point for those two vaccines, if you've got either the Moderna or the Johnson & Johnson vaccine, is that there is going to be word coming very soon within the next week or so about whether or not you should get a booster and when. So just stay tuned for that. I expect that they will booster the Moderna and Johnson & Johnson vaccines just like they have the Pfizer vaccine. The last part of the story that we want to kind of touch on is children. So children ages 5 to 11 are Pfizer tentatively scheduled to submit their data to the FDA for emergency use authorization in children on October 26th. They have a tentative meeting scheduled with the advisory committee on November 2nd and 3rd. So the best guesses right now in the healthcare field is that children, I should say specifically between the ages of 5 and 11, will be able to receive the Pfizer vaccine maybe even before Thanksgiving. The Moderna and Johnson & Johnson studies in children are still ongoing, but again, I think in coming months we're going to be hearing more about vaccines in that age group from Moderna and Johnson & Johnson also. Okay, so if vaccines and boosters are the present day, let's talk just a little bit about the future. So this graph is from NPR actually, but it has been published in multiple news sources. The data is compiled by a group called the COVID-19 Scenario Modeling Hub. So there are a bunch of mathematicians and statisticians that get together. They looked at 9 different mathematical models from different research groups, and they crunched all the data. They considered different variables, like whether or not a new variant emerges like Delta did, like whether or not the vaccines get approved for children under the age of 12, and they came up with this curve. So if you look at the curve, the dark gray line represents historical data. So that's the number of cases that we know were reported every day. There you go, thank you. Now where the dark gray line ends and the dotted orange line starts, that is the prediction from this point in time until March of 2022. And as you can see, the prediction is that the most statistically likely thing that will happen is that the number of cases of COVID-19 will continue to steadily drop between now until March of 2022. So they predict that in March of 2022, the number of cases that are reported every single day will drop as low as 9,000 cases for the whole United States. The last time that the number of cases was that low was in March of 2020, so a solid 2 years prior to that. Now, let's talk a little bit about that light orange cloud. As is always the case when we talk about statistics, there's a chance that things may not go the way that we predict. There's a chance, again, that another variant might pop up, that something may happen with vaccine rollout. So that light orange cloud is the area of uncertainty. And so technically, within all of these mathematic and statistic models, it's possible that our curve could get as high as the top part of that light orange cloud. That would put us back to about the same place that we were in fall of winter of last year, if that does happen. But odds are that we're going to continue to see cases dropping, and so that's really great news. All right, let's look at the next slide. Guys, I've made my graphic design debut, and I know a lot of you are cringing. So I literally copied and pasted the graph of the worldwide trends and the graph we just looked at, which probably wasn't necessary, but I did it. So let's look at it together. I drew in a blue line that represents the curve, so you can kind of visualize that in your mind. Really, I probably didn't need to do any copying and pasting. You can just visualize the curve, but bear with me here. The important point is I propose this morning to all of you that we truly are approaching the deceleration interval of this pandemic, because worldwide cases are dropping. We anticipate they're going to keep dropping as long as we stay vigilant, as long as we keep rolling out vaccines. as long as we don't have any new variants, which we shouldn't, because the less and less cases, the less and less likely we are to have new variants, right? That's how new variants happen. When cases are out of control and transmission is very high, it gives the virus more chances to mutate, right? So as the cases continue to drop, those chances are also going to continue to drop. And so it looks like we're looking pretty good. So this is where we start to get to a point of pandemic to endemic, right? It's not going to be a light switch. It's not going to happen overnight. We've talked in the past about how this is a marathon and not a sprint, but it looks like we're making steady progress. And speaking of progress, just one more before we end, I wanted to touch on just one more thing, and that is treatments. So remember that remdesivir, the antiviral medication, is the only medicine that's been approved by the FDA to treat COVID-19. It's only available through an IV, so you have to be either in the hospital or at least in some kind of setting like an ER or a doctor's office where they can monitor and give you this medicine via the IV. So when remdesivir was initially studied, it showed conclusively that it reduced the time of hospitalization from 15 to 11 days. The thing that it did not show conclusively is that there is a mortality benefit. So meaning it did not show in every single study that you are less likely to die of COVID-19 if you get remdesivir. Some studies did show that and some studies didn't. So that's always been kind of a dark cloud that hangs over remdesivir, is that the studies have been varied as far as whether or not there's actually a mortality benefit. And when we think about when we look for these treatments and we take these medications, that's what we're looking for, right? I want to be less likely to die of COVID-19 if I take this medicine. All right, so let's talk about the new kid on the block, molnupiravir. So this drug is by Merck and Ridgeback. They just announced yesterday morning, actually, that they've applied for emergency use authorization from the FDA for use of this oral tablet, so that's key, a pill you can take at home, for the treatment of mild to moderate COVID-19. So molnupiravir was originally studied in like the fall of 2020 in hospitalized patients. Those studies, so hospitalized patients that had severe COVID-19, those studies were actually cut short because it was shown to not be of any benefit. But what the company did is they started to study molnupiravir in people that have mild to moderate COVID-19, so people that are still at home and haven't been hospitalized yet. Those studies have shown that it reduces your chance of being hospitalized and of dying of COVID-19 by half. So that's huge. It's really great news. If it works out that this drug works as well as they're claiming their data shows it does, we're going to have a treatment that you can use at home that reduces your chance of being hospitalized or dying of COVID-19 by half. So that is really, really great news. Because when we talk about going from pandemic to endemic, it's more than just vaccines, which are absolutely key. We also have to have treatments available that we can use to treat COVID-19, just like we have treatments available to treat the flu. So I think I'm going to end on that high note this morning.
So, Dr. Gloria, although I am not as visible, I do want to thank you. I'm truly excited to hear about the predicted goal and head towards an endemic and better understanding of the viruses affecting us each day, and truly the home treatment. That's exciting. So now I'm going to turn back to the questions from our audience. As a reminder, you can submit your questions by using the chat function on the right side of your screen. And if we're not able to get to all of your questions today, we will include them in a publication and send it out to all who attended today. So one of our questions is, Dr. Gloria, if for the third vaccine, can you get the third vaccine in conjunction with the flu vaccine, the pneumonia vaccine, and or the shingles vaccine?
Yeah, that's a really good question. So when the COVID-19 vaccines were first being rolled out, we were recommending that you wait 2 weeks between having the COVID-19 vaccine and basically any other vaccine. And the reason for that is because we were still collecting data about the COVID-19 vaccine, and we really wanted to know that if there was a reaction, it was the COVID-19 vaccine and not a flu vaccine, for example, because both vaccines have very similar side effects. At this point, we have collected enough data to feel confident that the COVID-19 vaccine is safe. It doesn't cause any more side effects than, like I said, any other vaccine might. So at this point, there's no restriction for receiving either live. So some viruses, or some vaccines, I should say, use what they call a live attenuated virus. So not the COVID-19 vaccine, but for example, the intranasal flu vaccine uses a live modified virus. Those can actually make you feel pretty cruddy because it has a live attenuated virus in it and your immune system reacts very robustly to it. But even with those types of vaccines, the CDC is recommending now that you can get whichever vaccine you like together or separately. You know, I certainly have friends and colleagues that do feel, you know, a little sick after they get the flu vaccine every year, so they chose to space theirs out because they didn't want to feel twice as cruddy when they got two at the same time. But right now, the CDC is saying if you want to get both together, if you want to get three at the same time, that's okay.
All right, perfect. Thank you so much. So we'll switch over to a couple of the questions we've received during this seminar. One is there any harm in getting a third Moderna shot now instead of waiting for the booster to be approved by the FDA and the CDC?
Well, I don't think so, but I answer that, of course, without data in front of me because it hasn't been released, it hasn't been reviewed by the FDA and the CDC yet. I think it would be hard to get a Moderna vaccine at this point. You would basically have to lie because it hasn't been approved by the FDA, so you can't just walk into a pharmacy and say, I'd like to have a Moderna booster, please. They won't give it to you. Your only option to get a Moderna booster at this point would basically be to go in and say, I've never been vaccinated, and then hope that they give you the Moderna vaccine. But I don't foresee any issue with that, and I know people are certainly doing that. I'm hearing from patients that that's actually happening.
Okay, understood. How about this vaccine, the third vaccine? Is it specifically designed for the Delta variant?
That's a great question. The answer is no. So none of the vaccine manufacturers, Pfizer, Moderna, or Johnson & Johnson, have changed the formulation for their vaccine for the booster. The reason is that the vaccines themselves are effective. And even now, as our immunity wanes or drops off, the vaccines are still effective in reducing hospitalization and death. The thing that they're really not as effective is if you get COVID at all. So you contract COVID, you have a milder case, which in and of itself is probably not as big of a deal. That's exactly how the flu vaccine works. But in the case of COVID-19, we're worried about spreading it. So we are boostering vaccines, not because the initial vaccines aren't working to do what we want them to do, which is to reduce mortality or death and hospitalization, but because we want to reduce the spread of COVID-19. Because we don't want to take a chance that somebody that's maybe not vaccinated, a child or somebody who chose not to get vaccinated is going to get sick. So the short answer is no, it's the same vaccine. We're boostering just to help with transmissibility.
Okay, so we actually have a great question about being exposed to children. This one says, I am fully vaccinated, plus have had the booster. How protected am I, and can I be in contact with a grandchild who was exposed to another child at school who tested positive?
So each scenario is going to be a little bit different. And so you have to consider all the factors. What kind of exposure are we talking about? Are we talking about two kids that sat next to each other and shared lunch? Hopefully they're not doing that, but you never know. I don't know what they do at school these days, but anyway, are we talking, when you say, can I have contact with that grandchild? Are we talking about contact outdoors? Are we going to be wearing masks? I would certainly recommend that masks be worn just because you're having contact with somebody that's not vaccinated. But I think having an exposure to COVID, if you're fully vaccinated and in fact even boosted, is not necessarily a hard stop for not seeing your grandchild, particularly if your grandchild does not have symptoms of COVID-19. So if that exact same scenario happened in my family, what I would say is, okay, grandparents, come on over, let's meet outside, we'll wear our masks and we'll enjoy each other's company, and we'll keep monitoring to make sure that nobody develops symptoms. every one of these questions, and I get a lot of these questions, and I'll keep repeating this theme over and over. There's never no risk, right? I think in every case you have to consider what your level of comfort is and the specific, the specific details of the situation that you're considering.
Okay. We actually have another very interesting question. I know over the past few weeks, there's been reports and talk on the news about a mother's breast milk. And so this is referring to breast milk. And if a mother who has been vaccinated can fully protect the baby that is being breastfed.
Right. To be honest, because that's not my area of expertise, I'm not an OBGYN. I'm not as up to date on the current research, but the thought process for vaccinating pregnant women and for recommending that women breastfeed after they've been vaccinated for COVID-19 is that mothers can pass those antibodies to the baby before the baby's born and also as they're breastfeeding. So as far as I know, that's what the research has shown. That's our general understanding in medicine of how it works.
Definitely a very interesting concept for sure.
Yeah, I will say that there's been a lot of concern about COVID-19 vaccines in pregnant or women that are of reproductive age at least, and ACOG, the American College of Obstetrics and Gynecology, has come out and they have strongly endorsed the COVID-19 vaccine for women that are either pregnant or breastfeeding, because again, the thought is that you can actually protect the baby with those antibodies.
That's very good news and great to hear for sure.
Yeah.
Another question is, I've received the first and second vaccine, but I've also received the booster. I was not sick with the first or second, but was extremely sick with the booster. Is this common? And if so, what are some of the reported symptoms that you're hearing with the booster?
I wouldn't necessarily say it's common, but remember, when you feel sick after you've had your COVID-19 vaccine, that is your body's response to that, what it recognizes as a foreign threat. So that is your immune response. That's what you're feeling. So most people, if they did find the first two vaccines, they do find the third vaccine, but it's not impossible that for whatever reason, when you got your third vaccine, your body just mounted a more robust inflammatory immune response. The symptoms are similar to what you see anytime you get a COVID-19 vaccine, and actually they're quite varied, but I think the most common is just kind of general malaise, sometimes sore throat, headache, not feeling well. Some people have a low-grade fever. And I just want to point out, if you did not have symptoms when you got your COVID-19 vaccine, let's just say the first two vaccines you got, that does not mean that you didn't build a robust immune response. It doesn't necessarily correlate. So you probably had a great immune response then, you probably had a great immune response now. It's just for whatever reason, your body decided to respond a little bit more robustly.
Okay. I like that word robustly, and it definitely letting me know that my body's doing what it's supposed to do then.
Yeah.
So how about someone, if I am going into another person's home and I am wearing a mask and they are not, should I continue to keep my mask on while in that person's home?
So again, I think a lot of factors play into this decision. Are you both vaccinated? What's the comfort level? Your comfort level and theirs. I'll use myself as an example again, knowing I'm pretty conservative as far as COVID-19 precautions go. I'm probably more conservative than a lot of my friends. I would keep my mask on if I went into someone's home, because I feel like that's probably the nicest thing that I can do for them, because I'm reducing the chances of accidentally getting them sick if by some chance I had COVID-19. But that being said, I think there's plenty of scenarios where if you're both vaccinated, if you can social distance inside, if you can crack a window, if this is a really close friend that you feel comfortable with, if it's someone that you know is, like-minded in their COVID precautions, I think taking the mask off is perfectly acceptable in that case too.
Okay. So now we have a member or an attendee who has moved outside of the home and they are interested in having a massage. Do you believe that it is safe to get a massage or eat inside of a restaurant?
Before I answer that question specifically, I thought of maybe a follow-up to the previous question, just to point out, right now the CDC does not necessarily recommend that you wear a mask indoors if both parties are fully vaccinated and you're in a small number of people. So if I were to go, let's just say, to a very crowded, like a crowded bar, I guess, the CDC in that case would say you should probably wear a mask, because even though you're fully vaccinated, you don't know that everybody else in there is fully vaccinated. There's a lot of people in there. Nobody can social distance because there's so many people in there. But in a situation where you're in a small gathering, you're indoors, everyone is fully vaccinated, right now the CDC advises that you can take your mask off. So I should have added that to the most recent question. So going forward to the question about getting a massage or going to a restaurant, I'm going to go back again to, you have to really consider each individual situation and your individual comfort level. So if it were me and I wanted to get a massage, it wouldn't be a hard no, absolutely. I would just inquire with the masseuse, are you vaccinated? Do you plan to wear a mask while you're in my home? I wouldn't wear a mask while I was getting a massage because I feel like that would probably take away from the experience. But as long as I was comfortable with the answers that I got after I touched base with the masseuse, that would be something that I would absolutely consider. Going into a restaurant, again, if I'm fully vaccinated, I know that the restaurant is at least making an effort to try and distance tables. I would feel comfortable going into a restaurant and taking my mask off, particularly while I'm eating. Maybe I would put it on when I was done eating. But I think that those things are very reasonable to consider if your comfort level is there. And again, the CDC does not say right now that you can't go into a restaurant and you can't take your mask off. They just say that if you do that, try and just make sure that you're vaccinated and make sure that you're not going into a place where there's a lot of people in a small space.
Okay. And that's very helpful with coming holiday seasons and wanting to get together with family and friends and eating out and exploring the area. So very helpful. So another question one of our attendees has is, having been vaccinated, are symptoms, if I get COVID again or get COVID, should I expect that my symptoms, having been vaccinated, will be shorter or less severe?
I'll answer that in two parts. So data has held strongly that when you're vaccinated for COVID-19, you suffer a less severe case of COVID-19. So that means you're less likely to be hospitalized, you're less likely to die of COVID-19, and that's pretty significant. So I think a lot of us thought that when breakthrough cases happened, we would be asymptomatic or really mildly symptomatic. And I will say, I know a lot of people that have had breakthrough cases of COVID-19 when they're fully vaccinated and they contracted anyway, and they have felt pretty under the weather, you know, pretty fatigued. They've had fevers, so they've had sore throats. They've had some of the classic symptoms of COVID-19. But I think in general, again, if you look at the big picture data, people are definitely less sick when they're vaccinated than when they're not.
Okay. And I may have missed the part where you talked about the likelihood of needing to be vaccinated every 6 months, like, you know, the current getting the booster. Is there thought that we may need to continue to get a booster, kind of like we do with the flu vaccine and pneumonia, ongoing?
Right. So I think we've always known we were going to need boosters, just like with the flu vaccine. The question has always been, though, how often are we going to need those boosters? Right now, the manufacturers of the vaccines are recommending every 6 months. And right now, that's what the CDC is going with. Now, in the future, as we gather more data, as case numbers drop, as we move from pandemic to endemic, that might change. So in the future, we may get to a point where we're just getting a COVID-19 vaccine once a year, just like the flu. To add to that, and to be very clear, when we get our annual flu vaccine, the immunity that we gain from that vaccine does not necessarily last a whole year. That's why we always get our flu vaccine in the fall, because it's protecting us for that most important fall and winter flu season, right? Then you can still get the flu in the summer or the spring because your immunity has waned. So I imagine that that's probably going to be the case with COVID-19 in the future. Right now it's not, but again, right now we're still technically in that pandemic phase.
All right, so we'll answer one more question here, which I think was really fun, related to being in the pandemic phase. Should I start stocking up on toilet tissue and all of those items that were not on the shelves before?
I just want to point out, I'm really glad we haven't gotten any questions about my graphic design skills, but yes, that's an excellent question as far as stocking up goes. I think that if we trust the predictions that we're hearing, the number of cases are going to continue to drop through the spring, which is excellent. And that probably leans toward, we don't need to be worried about stocking up on supplies like we did at some point. But I will enter this caveat that because of COVID-19 as a whole, in general, we're seeing a lot of disruptions in the global supply chain. So when I'm hearing conversation about this these days, it's really a lot focused around like Christmas gifts, for example. So I'm hearing a lot of advice to go out and buy your Christmas gifts early because there might be delays, because of, again, the disruptions in the global supply chain. I know there's lots of things like construction materials, appliances, paint, that people can't get a hold of because of these disruptions. Not specifically the really important stuff like toilet paper and hand sanitizer, like we were seeing in the beginning of the pandemic, where there were shortages like that. My advice, I think, in a nutshell, would be that if you have items that you absolutely can't live without, I may stock up just a little bit on those things so that if it takes a little bit longer to find that item because of the global disruption, you're not caught off guard or you don't run out of it. But in general, I don't see any reason to be hoarding or stockpiling supplies like we were worried about again early in the pandemic.
All
That's a
right.
good question.
Thank you so much, Dr. Gloria. We could go on and have hundreds and hundreds of questions and keep you here, but we would like to go ahead and end our question and answer. Again, we will be sending out the questions that were answered today to all who are attending. We would encourage you to join us in our upcoming events. Both are for Goodwin House at Home on Wednesday, October 20th from 11:30 to 1 p.m. You can fall in love with Goodwin House at Home. We'll have lunch and an informational seminar located at the historic Blenheim in Fairfax City. If you've never been there, it is a beautiful, beautiful location. The next is Get to Know Us on Thursday, November 11th, which is also Veterans Day. So traffic will be limited and you can join us at Leading Age headquarters in Washington, D.C. If you'd like to learn more about any of our upcoming events, you can visit goodwinhouse.org. If you would like more information or resources on healthy aging, please also visit us at goodwinhouse.org. And you can go to resources for you. We'd like to thank everyone today. We are honored to serve you as Goodwin House employees, as one of the top rated employers in the area. Please feel free to reach us or reach out to us at 703-578-7201 or at info@goodwinhouse.org. We wish you continued safety and health, and please let us know if there's anything we can do to help you. Have a wonderful day.